All right, we're going to go ahead and get started now. Welcome to the call, everyone. So before we get started, so now I'm going to go ahead and read the medical disclaimer. The information provided is for educational purposes and is not intended as medical advice or a substitute for medical advice of a physician or other qualified healthcare professional. We do not aim to diagnose, treat, cure, or prevent any illness or disease, and you should always consult with a doctor or other healthcare professional for medical advice or information about diagnosis and treatment. And the information in this presentation has not been evaluated by the FDA or any other medical body. Well, good morning, good afternoon, good evening, wherever you are in the world. This is Dr. Doreen Arbo, and I am your host on today's call. And for those of you who don't know me, I am a clinical researcher and an author of several books. So welcome to our Tuesday call with Clayton Thomas, who is the founder of Root.
And enhanced by my amazing wife.
Absolutely.
Thanks for having
me. It's our pleasure. So Clayton has over 25 years of experience in the health and wellness industry. And for the past 16 years, he's been focused on detoxification and supplementation formulas with the simple philosophy, cure the cause. Well, Clayton, you're going to love this subject tonight. Are you ready? Are you ready to hear what we have prepared for you?
As a wise man once said, let's rock.
Yes. So today we're going to talk about addictions.
Here we go.
And we're going to learn about how it affects our dopamine and serotonin. We actually did a call on serotonin and dopamine last year, but not in conjunction with addictions. Well, of course, last week we had our product Q&A call. So now we're just going to move right into addictions. So this is a little bit of history on addictions. You know, addictions go back to 8000 BC. And in the 1930s, scientists began to study addictive behavior. And the belief during that time was that those who were addicted lacked willpower and were morally flawed. But today, groundbreaking discoveries about the brain have transformed the understanding of compulsive drug use. So addiction is a medical disorder that affects the brain and changes behavior. Researchers have identified many biological and environmental risk factors and are beginning to search for genetic variations and that basically contribute to the development and the progression of the disorder. I thought these little advertisements were quite interesting because, like, if you look here, Bayer Pharmaceutical, back in 1901, they were, giving heroin for coughs. Women, cocaine, for example, cocaine tooth drops. This was really interesting because, this is what they gave children, right? And then in the early 19th century, here, two-thirds of women were battling opioid addictions because of, they were prescribed opioids for menstrual issues.
And it makes you think, as things come full circle, right? It's not like, history doesn't repeat itself. It's just how they go about doing it.
Exactly. And here we can see countries with the most treated drug type. And again, opioids is, quite large. I don't know what this purple color here for Norway means because it says other. I guess it must be alcohol because that's the easiest thing to get here. Okay, so we have opioids. We have different countries have different cocaine, solvents. This is from 2012 to 2016, but I thought like the rise is quite high, and was a big shocker was Brazil.
Mm-hmm. Well, with their advancements in technology, going from what's considered a third world country initially now to being part of BRICS and their advancements in technology, their increase in revenue, and people getting more attached to more access to technology, you see that explosion where earlier in the United States, it was, years and years and years ago. Um, we'll probably get into more of this, but the interesting part is when you look at phones, right? Or you look at the smartphone addiction, and it applies to video games too, which we'll probably hit on, or I'll hit on at some point. That if you look at a couple behaviors of what cell phones have done, they manufacturers, and it's really the development and marketing teams, they know how to ping dopamine receptors. So when we had our phones initially, one, we didn't have all the social media aspects, but we didn't have notification.
We had this phone, Clayton.
I have mine in my bag. I have the bag phone. Oh man,
Hello?
so money. I have my bag phone. It's actually in my closet back home in my parents' house.
This,
so
as
epic.
you know, we had this on another call. This is the Mobira. This was the original mobile phone back in the day.
Mine
I
came
mean, I'm
from
telling
radiation.
you, I'm all about the first. I have all the technical gadgets from the very beginning.
That's epic. And the fun part with these is remember when these first started coming out, you make your calls, you get on your apps, but then they started to introduce notifications. And the notifications, then people can't stop looking because they want to see what's happening. They know how to ping the dopamine receptors in your brain because your brain's like, oh, something new. Oh, it's exciting. Oh,
somebody liked me. Somebody made a like.
Yeah, somebody liked something I did. Somebody liked something I said. Somebody posted something about me, right? And it's just pinging those dopamine receptors, which is the same thing that heroin does initially. It's the same thing that cocaine does that first time. And then you get that response and then you chase it, but you'll never get that back. You're right. You can never get that first hit.
Exactly. We're going to talk about that.
Yep.
So, addiction is defined as a chronic relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. It is considered a brain disorder because it involves functional changes to the brain circuits involved in reward, stress, and self-control. And those changes may last a long time, even after a person has stopped taking drugs. It's always, it's always a battle. So addiction is like, I guess like a lot of other diseases, such as even heart disease, both disrupt the normal healthy functioning of an organ in the body. Both have serious harmful effects, and both are in many cases preventable and treatable. And if left untreated, it can last a lifetime and may even lead to death.
And they both are reversible.
Absolutely. So serotonin and dopamine are both neurotransmitters that help regulate certain bodily functions. And dopamine plays a role in how we feel pleasure. It helps us, to strive, to focus, and to find things interesting. Whereas serotonin impacts every part of our bodies, from our emotions to our motor skills. And serotonin is considered a natural mood stabilizer. So if you look here, the green part here, that is for serotonin. This is the pathway for serotonin. And the red areas here, this is the dopamine pathways. So dopamine is best known for its relationship with pleasure centers of the brain located in the hippocampus. And dopamine releases, with triggered when a person experiences something that they find enjoyable, including eating, the act of sex, a good nap, and key activities that relate to survival. And dopamine is made in the brain through a two-step process. At first, it changes the amino acid tyrosine to a substance called dopa, and then into dopamine. And it affects many parts of your behavior and physical functions, such as learning, motivation, your heart rate, blood vessel function, kidney function, even lactation, your sleep, mood, attention, control of nausea and vomiting, pain processing, and movement, just to name a few. Whereas serotonin, keeps thoughts orderly. It prevents excitability or rapid firing of the nerve cells that lead to anxious feelings. It also manages behavior and perception, controls appetite, body temperature, sleep, and smooth muscle tissue. And serotonin even influences to some degree cognitive functioning, affecting learning and memory retention. And it's hard actually to find a function in the body that is not regulated by serotonin. So just
Well,
these are just a few things here.
and you look at both components for dopamine and serotonin and how they make you function and feel, and it gets to the key point of a dysregulation or a less than ideal amount produced, that our body and our brain is designed to, one, use these effectively. They're the two most powerful neurotransmitters made. We need them, but we desire all of these benefits and we seek them. So you see the same thing in animals in cribbing, right? If
Oh yeah,
if
I know
you see a
cribbing.
horse that's deficient in minerals or such, they'll crib. They'll start chewing on a fence post, or they'll chew on a building
Sucking
because they're
air.
trying to seek something.
Mhm.
Where in humans we do the same thing, but because of our environment, we self-medicate basically. Our brain is developed, and our central nervous system is designed to tell the rest of your system, seek to feel good. We all, as Dr. Rao and Dory, you've done such a great job of hitting on, is we always seek to find homeostasis. We seek to find balance, and we seek to feel
Oh,
good.
speaking of balance.
Oh, synchronicity. But that's the key, is if you don't have enough of it and if you're not producing it properly, your brain is going to tell you, find something that makes me feel good. And unfortunately, most of what we have access to us readily available is not the healthy choice or approach. So I cannot do that. It's good that there was a different model.
Well, as we know, taking or abusing drugs interferes with the balance of serotonin and dopamine, which can lead to addiction and several adverse effects. Now, imagine what happens when you induce a foreign substance that hyperstimulates either levels of serotonin, dopamine, or possibly both. Not only does the use of these substances hamper your perception of reality, but long-term use of the drug can also inhibit the natural release of these neurotransmitters, creating a physical dependence on the drug. So the person that, a person addicted to drugs isn't addicted to the initial high any longer. And like you mentioned, he or she is now dependent on the function of the drug. And we'll touch more on that later. So this is interesting here. The dopamine D2 receptors are lower in addiction, as you can see here. So here's the dopamine here. Here you can see with cocaine, meth, and alcohol and heroin.
You're probably going to hit on why, so I don't have to.
Well, in other slides here, we'll come to that. So here are PET scans that compare the brain of an individual with a history of cocaine use. And obviously you can see here the comparison again, which was like the other slide that we saw, like 1 month after use of cocaine and then 4 months after. You see it's starting to come back, but it's still not there. It has a long way to go.
Almost like you need a clean slate.
Well, you need all. You especially need the zero in. We don't do a lot of calls. I mean, I don't think we ever really have done a call on zero in. So that's why I think this will be a good topic.
This is the time for it, because this
Yeah.
is where the fun begins in that one.
Exactly. So this is really interesting. This is dopamine in obesity. Now, dopamine and of course serotonin play a key role in obesity, and we will cover this in a deeper. We'll go into it deeper and in another session. But right now, we're just going to just show you, because I thought it was really interesting here. Here on the bottom, you see all the normal views. in this scan, and then you see like in alcoholism, obesity, and and cocaine dependent. So serotonin and dopamine, like I said, it doesn't, it plays a role in diseases that aren't related to mental health. For example, again, obesity, right? And actually, in 2013, the American Medical Association actually classified obesity as a disease. So briefly, obesity affects the natural reward systems, and the amount of food eaten to feel satisfied. So imaging studies, like I said, show here that suggest that in people with this condition, that the body is not releasing enough dopamine and serotonin. So when I was doing the research on this, I said to Claire, my gosh, that must be my problem, right? Why can't I lose weight? I kept thinking, how I've been harping on this. And anybody who's been on this call, like for the last year, knows that I've been complaining about weight. And when I see Birgit losing like weight like crazy, she's just like wasting away. I haven't lost a pound. But I said, oh, you know what I'm going to start doing? I'm going to start taking it at night. And guess what?
Oh, yes.
It's going down. I'm going down. it's, it's starting. Yes, I was pretty happy. Okay. So this is really interesting here. So this is about the brain's reward center. So addictive drugs provide a shortcut to the brain's reward system by flooding the nucleus accumbens with dopamine. And the hippocampus lays down memories of this rapid sense of satisfaction. And the amygdala creates a conditioned response to certain stimuli. So, why are drugs more addictive than natural rewards? Well, for the brain, the difference between normal rewards and drug rewards can be linked or likened to the difference between someone whispering into your ear and someone shouting in a microphone. Just as we turn down the volume on a radio that's too loud, the brain of someone who misuses drugs adjusts by producing fewer neurotransmitters in the reward circuit, or by reducing the number of receptors that can receive signals. So as a result, the person's ability to experience pleasure from naturally rewarding activities is also reduced. So what's interesting here is this section here, is that the brain, the direction of the brain development starts back here in the movement areas, your physical coordination, right? Before it comes up to your judgment area, your prefrontal frontal cortex. So just remember that, because this is going to be really important in the next slide.
And it's also one of the reasons that for athletic performance, dopamine is so special and so amazing, and why the really all of the other products, whether they're synthetic or such, that produce dopamine are banned in sports, because it's such a strategic advantage for those that have higher dopamine levels. And that's actually been proven in some published papers on Olympic athletes, because what makes elite athletes different, or one of the primary things that differentiates them, is their ability to use and function with higher dopamine levels.
So remember I said the direction of the brain development, right, starts here. And this is the window here, between 12 and about 22 or so, 23 maybe. So 1 of every 10 American adults aged, 12 and older had used an illicit drug. So if you can keep children in this window here away from the drugs, right, or the substances, right, if you can protect them somehow, then while the brain has time, while they have time to develop their judgment areas, that doesn't happen until you're over 20. So this age is like really super critical. And it's so sad because like today, and even today, I mean, even back when I had kids, we started with the internet and all this kind of stuff, but now it's even worse because kids are going home, they're, on the computers. And this is another form of addiction, which we'll get into that later. But, again, it's those, hitting those receptors, right?
Well, and I will tell you, having two teenagers that are right in that window, and then having two older brothers that went through that window, and looking at the issues that are caused from this, and trying to have conversations, and being the stepdad, right, of coming into an environment later in development, and trying to explain to not only my kids now, but some of their friends, of this exact outline of, oh, well, they're not bad, you can see them in the media, they're legal now. And it's like, well, the difference between legal and complications and function and development and damage that they'll do to you are two complete poles. Kids today are flooded with so much information, especially around cannabis,
Oh
that,
yeah.
oh, it's this great thing, it's legal, everybody's doing it. And there's the conversation of the gateway drug, which it is, and but the understanding of, look, your brain's not even close to being developed yet, and the impact that this has, and how that plays into account. I was doing some of the studies over the weekend with some friends, actually, and honestly, as a parent, or if you are a parent, how crucial it is to come across as a Nazi and intolerant, and as I'm known as the guy that has no tolerance for it, because I grew up in an environment where both of my parents grew up in alcoholic households. The first time I got drunk, I was 4. Not intentionally, as my parents were chilling on a Saturday. They made 2 margaritas and got an emergency call to go down to the clinic, and they put the margaritas up on the counter so they could keep them away from the vibrant 4-year-old. But I managed, in the 20 minutes or so that they were gone, to climb on the counter, finish off 2 margaritas, lick the rims clean, and I was wired. And through from that point on, really through into college, I didn't drink, because I knew what the damage could be, because I saw it in my aunts and uncles and my grandparents. And I had the conversations with my parents, and I was fortunate to have mentors around me that are like, don't do this stuff. And unfortunately today, we don't have a lot of that. We have the inverse, right?
Okay, so here are the top 10 addictions, which, wow, alcohol was right
Mm-hmm.
at the top. And look at the impact it has on the community, in families. It's the worst thing. They I think back in they used to call it, alcohol was the devil's juice.
Mm-hmm.
So that's the list there.
Well, and everyone's asking about, where's porn,
Oh,
and
porn is in there.
was it on there? Hold on, go back one. I didn't see it. Everyone's
Oh,
looking
was it?
for it.
Well, sex and porn. This it all goes in there.
See, I would argue that, depending upon when that was done, when was this published in the Lancet? It doesn't give us a date. 2010. Yeah. So
No,
prevalence of social media and the web over the last 11 years, I'd probably put porn in the top 5, and I'd probably put it in number 4 above cigarettes, maybe even above cocaine. The money, right? I mean, the porn industry generates more cash than, most industries, and it's not talked about. And especially, it's interesting how it affects different populations here in the United States that claim to be pure, especially different religious bases. Keep going, proceed.
okay. All right. So, okay, we can see that. Well, this one here is really interesting. This is your brain on drugs.
I used to love those commercials, by the way, because I love eggs.
I saw that. I remember that. That pan, right? I should have.
They're like, people are like,
forgot the
this is your
video.
brain. This is your brain on drugs. You're like, wait a minute. I love fried eggs. How do I get there? Can I have maple syrup with salt and pepper?
So, okay, so this one here is really interesting. This they used radioactive tracers on the PET scan to show a person's brain on cocaine, and the areas of the brain highlighted in yellow where cocaine is binding or attaching itself. So this PET scan shows us minute by minute in time lapse sequence just how quickly cocaine begins affecting a particular area of the brain. So we start in the upper left-hand corner, and you can see that 1 minute after cocaine is administered to this particular subject, nothing much happens. All areas of the brain are functioning normally. Then we look at the next slide. 3 to 4 minutes, we see there are some areas starting to turn yellow. And these areas are part of the brain structure, the striatum, which is the main target in the brain bound and activated by the cocaine. And then if you look at the next slide, 5 to 8 minutes later, we see that the cocaine is affecting a larger area of the brain. And after that, the drug effects actually begin to wear off, which is amazing because you only, after 8 minutes, it's reversing the other way. So 9 to 10 minute point, the feeling of being high is almost gone, unless you take more drugs. And the experience is pretty much over within 20 to 30 minutes.
What a freaking waste for you. You think about that, for how much cocaine costs.
I
And
know.
I've never touched the stuff,
Me
right? I
either.
knew early on. And it's interesting of talking with people that have used a bunch of cocaine now because of what we're doing, and working with people that are in recovery or that are having fun here. And it's interesting because of what we do, and talking with people about how it makes them feel. I had a moment a month ago and having that conversation. And I'm like, wait a minute. So what you're using drugs for is so you can feel like me normally. Like, interesting. But the heroin aspect, and the same thing with meth. And Teresa, let me see if Teresa's here, because she can probably talk about a bit of this at the end. She's here, but she can talk about her experience with meth in doing the same way, that it only lasts 30 minutes. You get this amazing feeling and then it's gone, and then you chase it. So like you talked about,
Yeah,
you
but
get that amazing
you're only going to have that high for the first time, right?
first time, and then you
But then you're
chase the high.
constantly chasing it all the time. You're never going to get to it. You have to keep using more and more and more,
Yep.
because you're never going to get that feeling that you're always chasing after. And then it becomes such a problem that, I mean, like, yeah, I know a lot about meth. It's bad stuff.
It destroys you in every
Absolutely.
aspect.
It's one of the worst drugs.
Yep.
So this is Dr. Nora Volkov, and what she says here is the brain is modified by the drug in such a way that absence of the drug makes a signal to their brain that is equivalent to the signal of starving. It is as if the individual was in a state of deprivation where taking the drug is indispensable for survival. I mean,
I think this is a point that is so crucial, and we'll probably get in this, of being able to offset that. And it gets back to the point that you made initially. If you talk to people that are in recovery, right? And it's been a conversation we've had with some amazing interventionists, and we're working on collaboration with some of the top interventionists in the United States right now in the addiction recovery space. But for those that you talk about that are in recovery, they'll tell you, and it sickens me. And even talking with them, the comments are that there's been no changes in 30 years in treatment and in therapy, which is, I'm beguiled by that. But the issue is if you don't change the neurology, if you don't change your brain biochemistry, if you don't give your brain the alternative, or you don't give your gut and your brain the ability to do it naturally and reset it, you're never better, because
oh,
that
not to cut
thing
across
is
you,
always there.
but even when they get you on methadone, that's addicting. So they got to get you off of that. They got to get you off of that too.
It's the horrible part of how drug addiction treatment is done here in the United States, and it's probably done the same way. I know they do it in Canada. I don't know if they do the same thing overseas. They're like, oh, heroin is terrible for you. You shouldn't use heroin. It's bad. Let us give you a different version of it, and we'll say that you're medicated. I'm like,
Yeah, but you know what?
Seriously.
But you know what? When you go into these recovery centers and you see, like on the PET scans, you see like 4 months, their dopamine levels are still not up to par to what normal is. So it's always a constant battle. They're missing the whole boat. I mean, they need to like, okay, obviously it's a zero, zero in would be amazing product because it's going to be hitting on those areas to help in the recovery process. The recovery is going to, it's going to get them back up to normal quicker.
But it goes back to the point you mentioned initially of how it hits on the Trinity and not just
Yeah.
zero in,
Yeah, that's true.
because Restore actually assists with serotonin and dopamine production. And it does it, and
Yes.
it does it through two different pathways, but
Mhm.
then also how Clean Slate assists in, well, not assists,
Well, okay, but
cleans up the environment
yes,
and how they all work together.
because also in the environment we have heavy metal toxicity, which is also playing a role on the neurotransmitters as well. Okay, so obviously we have genes, but then of course that could be, epigenetics, which can
Yep.
also change too, right? And then here, adverse childhood events, 5 or more is 10 times risk for substance use dependency. And then, of course, there's peer pressure, there's drug availability. I mean, okay, I know this, parents doing drugs, in the home and the children are there.
Do you
This
have that
happens.
mom hitting a crack pipe? Is that seriously what I see? That is amazing.
Yeah.
What a great demo.
In arguing and all kinds of different things. But yeah. And this is a slide about the percentage of people addicted to drugs. And it's not just, it's also in schizophrenia, major depressive disorders, bipolar disorder as well. And addiction, increased risks for addiction, right? So if you're already addicted to something, it just heightens the risk of becoming addicted to something else.
Well, and it goes back to your point of if you use one substance and you got that ping initially, you got that hit, but then that substance isn't giving you what you need, your brain is immediately going to start looking for alternatives. It's like, okay, alcohol got me here initially, and now I'm having to use this much alcohol and I'm still not feeling good. What's next? What else can I find that's going to give me a rush? And there's, well, and it also creates the environment, because if you're drinking a lot, you're around other people that are probably consuming alcohol, which means there are other substances that are being used around those circles, and you create that pathway. And it's like going back to kids of, we have a major problem here, well, now fentanyl, but we live in an environment where access to things is so prevalent because of what adults have access to and the amount of money that's around here, that people just say, I'll do whatever I want, that you see that process, and kids see it, or they are able to acquire things from their parents or from people around them. They're like, well, they're doing it and they say it's great, or it's happening there, so we can do it. And you just see this pathway.
Oh
And
yeah, there's also the peer pressure as well that plays into it. And then don't let's not forget about food and sugar. This is very highly addictive substance,
Mhm,
right? And the more you keep doing it, the more your dopamine is even more depressed.
mhm.
So, and then it just creates the cycle.
And heroin, like you have on here, heroin's the end game. And heroin's usually going to be what ends up killing you, because you'll go from heroin, then you get into fentanyl, and it's only a matter of time before you just have enough and you're gone. And I'll give you some experience. We'll probably hit on this, but are you going to go over more? You're going to go more over heroin? Because I'll wait.
No, go ahead.
So when it comes to addiction, and if you're working with someone that is in the process of using substances, that wants to get clean, or if they're in recovery and they're recently in recovery, and there's always the risk of going back, right?
Mhm.
Of relapse. If you're working with people, or you have friends, I won't say working with, because none of us are treating anything in this space, is one of the most at-risk spaces. Christina and I have had conversations over this for the last 2 weeks because of some of the stuff we're working on internally. That when she was working with the seriously, persistently mentally ill and working in the drug addiction space, it is the highest level of risk for companies and such, because of litigation, because you have people that will go into recovery, will try to get into recovery, and they'll end up killing themselves, or they'll end up killing someone else, or the complications that come from it. And I've been fortunate to work with some different individuals through this process to see how things function. And here's what's crucial. If you start using Clean Slate, it is so effective in cleaning up your body so quickly and so passively that if you are trying to go through the recovery process, your tolerance for chemicals drops so significantly, so quickly, without noticing it, that if you're using heroin and you build up a tolerance to it, and your tolerance is up here, and you want to get off of it, you start using Clean Slate, even in a couple days, your tolerance drops so significantly because of how so effective this amazing little bottle of greatness is, that if someone goes back and uses, they're going to use at the rate that they were used to. You will overdose and it will kill you. So if you are working with friends or family members or someone that is in this process, you really have to be cognizant of how powerful this stuff is, because if someone's on the edge of going back, you can tell them, look, if you use this and you go back, it'll kill you, because your behavior is going to cause your demise, not because of what this does, but because of how good it is at cleaning you up. If you make the choice to go back, your decisions and your behavior will probably kill you. And we had an instance, it was a year, well, where we're in is April. So about a year ago, we had one of Ted's friends has Lyme disease, and he's in a lot of pain. And part of his treatment protocol was ketamine IVs twice a week. That's some serious pain issues. Mondays and Fridays, he would get a ketamine IV. And if you don't know what ketamine is, it is a tranquilizer used primarily in horses.
Yep.
And it's strong stuff. So he'd been doing this for months, and we put him on Clean Slate because of its benefits of cleaning up the mess and spirochetes and binding some of the biotoxins and biofilms and the heavy metals and everything. And I told Ted, watch what happens, because we're going to see his tolerance decrease so much he might OD on ketamine in 4 days. I mean, who would expect to see that with a little bottle that you're only taking a couple drops a couple times a day? But he got his bottle. So on Monday, he did his ketamine IV. Monday night, he did 10 drops, and this was, maybe we shouldn't have done 10, but it proved a point. 10 drops Monday night, 10 drops Tuesday morning, 10 drops Tuesday night, 10 drops Wednesday night, Thursday night, Thursday morning, Friday morning, got his IV because he followed up with his weekly routine. We talked to him on Monday, and he called, he's like, I was sick all weekend. I had diarrhea the entire weekend. I was sleeping. I felt horrible. And Ted had him on speakerphone. We were talking. I looked at him and was like, he OD'd on ketamine. Those are all the symptoms of a ketamine OD. And it didn't give him a near-death experience, which is why people use high levels of it. It'll create some euphoria, and then it'll create a near-death experience, and then it'll create death if you use it improperly. But he clinically in 4 days had decreased his tolerance so much that the treatment that he was on was too effective for what he was doing. And that is why we have warnings on the labels for Restore and Zero In, is these products are so effective at what they do. If you're using pharmaceutical protocols, a healthy body doesn't need drugs of any kind. right? We know that with how zero in functions. You can feel so good. There's no chemical you really need to take that will get you where you can get with this. I tested that over the weekend personally. I got my first experience playing with this. But it is something that you have to be really aware of. These products are so effective that one, when people ask about the warning label, that's the response. These things are so effective. They come with a warning. They won't hurt you. They're just so good that other things that you're doing might need to be adjusted. And if you are doing things that, are really not good for you, these will put you in a position that if you go back to doing them, you can hurt yourself. So don't do it. That was my rant.
Okay.
Oh,
Toxic metals downregulates essential neurotransmitters.
in the brain, but also where we know a lot of them are produced, they inhibit the production as well. So they downregulate up here, but they inhibit the production in your gut.
Yeah,
It's a double whammy.
absolutely. Okay. And we created a new wheel, the addiction
It's the
wheel.
wheel of fun.
So we created this new addiction wheel, right? So, I mean, again, you can use it any way you like. You can change the labels. You can just, but it also could be a self-assessment tool for
The cosmetic part might get me a little bit, but
yeah. Or shopping.
no, that's not mine.
Yes, I know. I know you got some man bags over there.
Hey, I did that because of my addiction for love. She loves the bag, so I'm like, okay, you know what? I can bond in this moment. She loves them, so if I get one, maybe she'll love me more.
Oh, okay. Okay.
I was
But
wrong in that assumption.
you were actually supposed to buy it for her so she loves you more.
Well, she has
Not buy it for
plenty,
yourself.
as do you. And it's the process of knowing you can only carry one or two. So if I carry one by osmosis, it's like she's carrying three.
See, like I'm not a shoe fiend like Claire is.
Yeah.
Okay, let's move on. All right, so we can start with alcohol. So alcohol here, again, it's the scale of 1 to 10, 10 being the best. And so, of course, obviously, we have a person who's drinking quite a bit. So because we rated him as a 3. And then these are just like questions that you can ask. It doesn't have to be all 3 of them. It could be one. It could be a question of your choice. So it's just ideas. And then, of course, drugs. It could be any kind of drug, pain medications, any kind of stimulants, and recreational drugs. These are all the drugs that are legal drugs, right? Your cigarettes and things like that. Okay, food. Food is here because food is used as a drug in many different ways.
Corn dogs are addictive, everyone.
That's because they're savory for you.
Mm-hmm.
Yeah. So engaging in risky behavior, for example. And life purpose. I think this is really important to know, to like really assess yourselves. What is your life purpose? Because without your life purpose, I mean, you go into other things, right? A lot of people.
Well, keep going.
No, I was going to say, like a lot of people that have problems, they have no life purpose. This is the issue.
But it also speaks to the importance of balance.
Yeah.
And for me, growing up, when I started working, and my mom and my dad had this conversation with me because I have a family history of addiction, right? And we know that heavy metals and stuff are passed maternally. So you can have some of the triggers, but even if you have the triggers, it's how you apply them. I didn't go a chemical route. My addiction was work. And I put such a great focus into work. And then it's really important when you figure out your life's purpose. Mm-hmm. And what I did when I figured out mine 16 years ago, it's that work-life balance
Yeah.
that's also really important is you can have addictions. You can be addicted to your life's purpose.
Yes.
Like you're talking about where you don't have it and you don't know it. But if you do know what your life's purpose is, and this is one thing Christina and I, work to manage, and it's more on my side than on her side, that what we do and what we've created is so much of what we are and what we want to do and how we want to do it, that you have to create balance. You have to pull back. You can't always drive on that, because you'll burn out, and it'll cause other complications. It can cause relationship imbalances. It can cause imbalances with friendships. It can cause other areas of concern, because as Dr. Rao hits on, it's a mobile, right? You have to have balance, and you look at it on both sides. So you can say, oh, well, I don't know my purpose, or I do know my purpose and I'm driving too hard all the time at it. So you got to be able to pull back.
Yeah, absolutely. The work is, like I feel it myself, it's like almost 24/7.
Yeah,
Christina's calling me. She goes like, "Don't you sleep? Aren't you sleeping?"
I know.
Like, but
And
she's
it's
the
the
same
best
thing.
part.
She does the same thing too.
She calls you when we get home and we're supposed to take a break. And then I get to talk to the hand, talk to the hand. I'm talking to Dory. This is my life. Okay.
Oh, it's like Three's Company now.
Exactly. She's in her closet going, leave me alone. I'm talking to Dory. I'm like, okay, where's Kurt? I'll talk to him right now.
Yeah. Well, I think I told you that Kurt and I started golfing now, and it was actually for the weekend. We didn't have, I mean, like we were gone the whole weekend, I mean, like, 8 hours just on the course golfing. It was so fun. And I didn't have my phone. Like the second day, I had my phone with me, but I wasn't really looking at it. But the second day, I said, I don't even need my phone. I'm not even going to look at it. I didn't look at my phone. I didn't do anything. So I understand what you're saying, about the balance, because that is true. But on the other hand, I know that a lot of people that are driven with work and stuff like that. And I think I told you, like, when I was working, my specialty, was, cardiovascular patients, and for stem cells and things like that. And, I have spoken to over 1,000 patients. And one of the things that they told me was, when they were at the end of life, the end stage, and one of the regrets that they had was that they worked so much that they never had time. They never took time for family. So at the end, they want to spend time with family, right? It was like backwards. So they were
Yeah.
spending all their time working, working, working. And they say, like, for what? Why did I even do this? Because now what they really realized is that the family was the most important thing. Right. So
Well, and
you're right. You're
it's
absolutely right. We have to have the balance.
and it's interesting in the conversation, right? Because so whether you're a high achiever or what your focus is, we think that we have to drive constantly to achieve, right? And whether it's money or whatever it is you want, not understanding that the more you can relax, the more you can actually take yourself away from that environment, the more productive you're going to be when you go back to it. But also in business situations, the more respect that you're going to have from others, knowing that you can take a break.
You
And
have
when
to.
you do,
Mhm.
you will, it's just like these things. Guess what happens if you're on this constantly and you don't put it down? It will die. You will
Exactly.
kill the battery. So what do you have to do? Sometimes you have to take it and put it on its charger and let it take a break. We are no different. So it's
Absolutely.
important. And it's one of the cool things I love to watch in tracking our volume, for Root with our sales volume. Guess what happens on the weekends?
Do we take a
Sales
break?
dip. Sales dip, as they should, because people are taking a break. And it's awesome to watch that behavior. But what is also cool to see, and it would be cool to track this, is how the consumption of Zero In should spike on the weekends because of how amazing it is. And that's what I learned. Have you taken Zero In and played golf yet?
Oh yeah, I take zero in like 3 times a day.
I took 2 capsules before I play. So I got to play golf for the
Oh,
first time in 9 months on
really?
Sunday.
What's your handicap?
I'm an 8. Actually, I'm a 10 right now.
You're kidding.
No. And it
Wow.
was crazy because I hadn't played golf in 9 months. So Saturday, I got out and I hit a couple balls and played a couple holes just to sneak out because I hadn't done it. Christina had our amazing baby daughter in traveling to New York to go look at schools for where she wants to study music. So I was like, okay, I'm gonna go get out. But I hadn't hit balls in 9 months. So you know it's not going to be an experience that's good. So I took 2 capsules of zero in, went to the range, and all the balls were going straight. I was like, oh no, this is crazy. And so I played Saturday or Sunday morning with a couple people, and I told them haven't played in 9 months, don't expect much because one of the guys was a 2 handicap, meaning he's really good. The other guy was like a 6 or an 8. He's really good. And I took my 2 capsules. First hole, pipe a drive, hit a wedge to 6 feet, make the putt. I'm like, so I birdie the first hole, which is really good. And they looked at me, they're like, you sure it's been 9 months? I'm like, yeah, I'm chemically enhanced right now. I will tell you from a sports performance standpoint, zero in is so beneficial, especially in the sports where the mental game is so crucial, which is this just in all of them. It is amazing. And I did a second study on Saturday because I took 2 in the morning when I hit some balls. And then our oldest son had friends over, and we had like a dozen people over. And so I got to entertain and hang out with the youngins for a bit. So I didn't want to get too crazy because I knew I was going to be drinking with them to have some fun. So I took 4 capsules of zero in just to see what would happen. And
All at one time?
all at one time. And I had everybody else take like 1 or 2, and they're like, this is the most amazing stuff.
But wait a minute,
But
just so everybody knows, like we don't recommend that, but
no, this is what I did for me personally, because
yeah.
I play with stuff on my own and I like tweaking my biochemistry a little bit because I've learned from Harry. But I I don't drink a lot for one. I mean, I'll have a margarita, maybe 2 margaritas, and I'm good because I don't go crazy. But I don't remember how many drinks I had, but at the end, when we was hanging out with my son's couple buddies who can drink a ton and at the end of the night, did 4 shots, large shots of Jack Daniels,
Mhm.
and which is not recommended. I This is my experience, right? So this is not something that is to be expected by anybody else. I wasn't drunk. I know if I had blown on a breathalyzer, my blood alcohol level was high, but I did not feel drunk. I went to bed and woke up the next morning and played golf. I was like, I feel a little bit worn out, but I drank water. I took my Restore and took 2 more zero in the morning. I'm like, holy cow, this is crazy. So that speaks to the chemical response and what your body can do when it's functioning well. And it's not something I recommend for everybody, or it's something we do on our own. Um, but it was an amazing experience for me. Will I do that again? Probably not. Um, but being in the environment and having the opportunity to make sure that I could put my body in the position that I naturally could overpower the chemicals to say, okay, I'm going to put my brain in a position where my body is already producing dopamine and serotonin to feel really good, and it's already functioning higher than any chemical is going to get me to. And that's honestly the pathway I think that's taking place. Is there's no chemical that can overpower what your body does naturally when it's working properly. So it's quite unique.
Yep. Okay, so this is about gaming, social media, and your mobile phone.
Well, and this is where I have the conversation with Kreider, our 16-year-old, because he's playing Call of Duty constantly, and this goes to the phone and video games. I don't know if everyone here plays video games. When I was younger, video games are programmed to ping dopamine receptors, right? That's why you want to keep playing. but we've seen a metamorphosis of like Call of Duty and a lot of these first person video games. And if you know what you're looking for and how they're programmed, you'll see it. They do it even in basketball games now. Where usually back in the day, you play a video game, you'd play basketball, you play Madden football, you would just play the game and you make plays, you try to get the victory. Now with video games, there's all these little different awards and notifications and ranks that you earn. Each one of those is like a dopamine ping every time, because your brain is then looking for it and it gets excited. And it's like, how can I get the next one? What can I do? How do I earn that next award and reward? And you just keep going because it's just pinging dopamine every time. It's just pinging those dopamine receptors. So it's keeping you more alert. You're driven. You want more of it. And they don't stop. And you get to see the addiction behavior when you try to take it away. They're like a crackhead because they can't handle it and they melt down.
Mm-hmm.
So
And now
serious.
shopping.
I have nothing for that one.
Okay. Cosmetic.
Look at my hair. I have no addiction to hair.
Okay. And then of course, gambling is a big thing.
That is one thing for me that I have to pay attention to because of the competitive aspects of it. And, I think the important part is just becoming aware of your behavior. And, some of these things they're entertainment. They're all designed to be entertainment. Some things are really bad for you, but there's the difference in, creating that balance, right? Of being able to enjoy yourself, but when it goes beyond enjoyment and it becomes something that drives you. I love playing poker, right? Because it's something for me that keeps me in check. Because if I'm overly aggressive and I make poor decisions, it costs me money. Whereas if I stay in balance and I do the things I know I'm supposed to do, I can make money, or I keep my money, and I can talk trash while I'm on the table. But it's maintaining that balance and sitting down with people and seeing those that are addicted to it. It's a very interesting environment. I haven't played poker on Zero In yet. It will be done soon, though. So I can guarantee you that your perception will improve.
Absolutely. So, and then of course, these are the results. But like I said before, you guys can do whatever you want with it. You can ask different questions, and it's just a nice little self-assessment tool. So that's it for today from my side.
Well, and it goes like we've hit on, and just tying everything together, that if you want that little brain of yours to function the best way possible, because we know that your brain pretty much controls everything else, that it's not a one-stop shop. There's not one thing you do. You've got to have clean slate because you want to clean up, the entire system from head to toes. But then how Restore works to restore the gut, and how Zero In works to improve dopamine and serotonin production. And like you were talking about, balance your circadian rhythm. And I think this is important for everybody to understand, is play with timing. Because unlike really any other supplements I've ever heard of, that the timing and time that you take Restore, Clean Slate, and Zero In. And just so you know, Zero In, we haven't actually released the patents that were done with the research team that Christina worked with on Zero In, and the science behind its ability to reset your circadian rhythm. And it's actually a sunshine pill. We just haven't talked about it. We'll probably do this since it's summertime. The consistent use of Zero In actually keeps your body in summer mode. So Dory, like you're finding of using it at night, your body feels like it's in summer, so it'll shed fat, or it'll stay lean, because normally if you're in winter mode, we pack on fat. And I think you get to deal with the dilemma of your location being so far north that your body is going, oh, wait a minute, you know what, light and everything is a little bit off here, so I've got to keep the fat on because it's going to get cold in the wintertime. but you want to
I'm
be
like a
in summer
seal.
mode. Yeah, exactly.
No,
So you want
actually,
to be in summer
no.
mode.
Wait a minute. Actually, I think I told you this winter was the first year that I did not have to use my light.
Yep.
No bright light this year.
Yep. And that's the balance. And if you look at Claire and you look at Birgit and you look at a lot of Alfred and Nude and a lot of the people that have been with us for months and a year now, if we go back, and everybody should do this, if you get older photos of you, even from a year ago or more, I even myself was like, yeah, you're not the same person. Michaela's the same way. Michaela's lost 20 years, it looks like, in the last week, from what photos she had and now how she looks currently. I mean, and people spend a lot of money on anti-aging, but I mean, we're doing it in a level that I've never seen before. I mean, you look at Christina. I mean, I get to
Oh, I
wake up and
know. She looks amazing.
my wife's already hot,
Where
but
is she?
my, she's in meetings all day today.
I know. I
But
know.
man, I get to get up and I look at her in the morning. I'm like, good. Every time I get to see her, if I'm away from her a couple minutes and I get to see her, it's like the greatest moment of my life every time I see her. But to watch what she's doing, because she's doing her restore facials more often than I am, and it's insane what this stuff does to you when you're doing it internally and you start using it externally. I mean, it is like the greatest long-term dating or marriage. We need to actually do this from a like marriage counseling piece for guys, that, hey, your wife needs to do these things, because if you think you're going to stray, your wife's going to get younger every freaking week. So it's like you're dating a new woman every week. It's like, this is great, and I can't, I mean, to see how she's, like, her skin, because of the cancer history and everything that she's had to use on her face in the past for protocols and treatment, and to watch how people respond. They're like, holy, and everybody knows my wife is hot. I mean, I deal with it, but now it's like, holy shnikes. I feel uncomfortable walking into public places because I don't look good enough. And people look at me like, how are you with her? I'm like, well, I'm really special. I have a lot of personality. That's all I got.
It's not
I'm
the
going to have,
looks, it's the inside.
that's right. I smile a lot and I try to make people laugh at me. It's my coping mechanism for being a cross between Quasimodo and the Elephant Man, but only the good parts, it's like, look at me.
I think those restore packs need to be bigger, because I've actually, like, when I take it, I like to just like have it in my mouth for a little bit.
Yep.
And then of course, like you can just take it down and like in a couple gulps, it's gone. And I need to have more for my face, right? My
Yep.
facial. And then I started finding I had some muscle soreness from playing golf on my arm. And so I started putting it on my arms too.
Yep.
This works really good. And then of course, if you guys like, I think Christina even I know I've heard her say it before, and I've actually recommended this before, that if you have any kind of sinus infection or headaches or anything like that,
Yep.
you could just like paint your face with it. I mean, it's
Yep.
pretty amazing.
Yeah. You can wear it as war paint, and it's
And get a
amazing.
facial at the same and get a facial at the same time.
Yeah. And that's the one thing for me that I've noticed in trying to teach people is, if you put that film, I use a little bit more than most when I do my facials, but after about 10 minutes, the firming aspect and the tightness that you get because of what those ingredients do when they're driven into your skin is, I've used different skincare products, but never anything like this. And just with how good your skin feels. And if you have pets like I do, the Tilly dog loves to lick my face when I have my facial. She's like, oh, wait a minute, that tastes good now. It's like,
Oh,
so,
here's a question for you. Can you overdose on Restore?
well, let me ask Mr. Harry on that, because he took a box in his first day and he's still here. And then he did a box the second day. So
A
can you
whole
OD
box?
on it? He
Like
went through a
15?
box his first day,
Oh
and
my
then he did a
God.
box the second day. because he had so many rewards from sharing with people that he was like, why not try it? And well, and Michaela took 4. I mean, she'll tell you that she was like floating and felt so amazing that you can't overdose on it. I don't think you need that many.
No.
But it's better than we ever imagined. And while it was designed to be taken maybe a half a sachet or 1 sachet a day or every other day, everybody's a little bit different. You know, Christina and I have found that 1 or 2 is amazing. But I got to grab the kid real quick because he keeps blowing me up. So go ahead.
Birgit has her hand up.
I found something on the internet that is pretty good, and they have like a brush for masks to put on in cosmetic pages, and it's like a handle, and then instead of brushes, it has sort of a silicone movable thing, and this is great to put on normal masks, but also our Restore, because you do not get the yellow on your fingernails, or I have it always under my nails, and it colors the keratin of my nails yellow. And I'm brushing like crazy. So if you take that brush or spatula, whatever, silicone, and take it from the package, the cut open package, and put it on your face or on wounds or whatever you like to, it's really good to prevent your fingers and cuticles from getting really yellow. And a lot of it comes on your face, and you basically take up everything from the sachet cut open.
That's a really great tip. Has anybody been using it with dermabrasion or derma rolling? I mean, has anybody tried that? I'm sure I'm going to hear next week. Somebody's probably going to be doing it.
What is that?
Derma roller. Like you take that little roller and you.
Is that the one where it does like microderm, like little needle punk?
Micro needling.
Oh yeah. If you do that, I think it would be insane. What happens? Patricia has her hand raised. Go ahead.
Yes, I have tried it. I have tried it, Doreen. It really works wonderful. It really is great.
Oh, tell us what you did? I want to try it.
It's just I put the Restore on first, and like Clayton said before, I every now and again I put 1 drop of Clean Slate on as well. Mm-hmm. And when I first did it, I put it on too thick, and you should have seen the state of me. I looked like a Simpson. And so I've calmed down with that one. So I just take a little bit, but I put 1 drop of Clean Slate every now and again on it. And I also, if I don't do that, I go over with a Dermarolitz. You have like crystals, I don't know, Rosenquartz, what's that, the rose quartz, what you can use. You have them in different jades, you have all sorts of stones you can use. But it's really nice. It's because it does dry in quite fast, but you can still go over. It's really lovely.
Oh, great. Great tip. Thank you.
Welcome.
Here, hold on. Let me do this real quick because I know she's here, but instead of pulling on her, I'm going to play this for you guys so you can see it, because this was her first. There's nothing like the first time, right? It's one thing to hear a testimonial from someone after the fact, but because we were having this conversation, I'm going to play this, and I'm not going to ask her permission either because I know she'd let me do it. So watch this. Oh, hold on. That's not working. I got to turn it. Hold on. Go back. This is this amazing woman. And what's cool is she doesn't look like this right now.
Feel like everything is okay and you just crave it. That's why people get so addicted, because it feels like love, and it feels like, oh my gosh, this is the way I've desired to feel this way all of my life. And yet you want to feel that way. But when you're not taking meth, that's why you want to go back, because you want that feeling back. But it's just like having a best friend and love feels like you just feel so, because there's no feeling for love. You know what I mean? There's no feeling that you feel so loved and you just feel so good. And there's that drug that really makes you, for a little while, And then you just want to keep getting that. And when you can't get that anymore, then that's when it really starts hurting your body. But this is what it feels like. It's that feeling of just happy and joy, and like my body feels good, and I just, and that's literally what this feels like. That's awesome, Teresa.
Teresa, you got to follow up on that. Did she leave? No, she's here.
No, I didn't. I'm just crying. So you gotta give me a minute.
We love you. You're amazing.
Because that is what it feels like, guys. And then to get that back and to get that feeling back, it's like, because I just think every day I'm getting my life back. I'm getting that feeling back of that love. And man, I haven't cried like this for a while.
You're not alone.
This is real. This is real. And I was thinking today that, if you want that quick fix of drugs, you're going to get it, but it's only going to last for a while. This is a fix that lasts for a lifetime. And every day, it's not quick, but every day you just get that feeling of getting better and better and better and better and better until you just think, could it get any better? And it does. And, I don't want to take advantage of that feeling, because I just want to always, it's almost like when I moved from Ohio to here, and I used to look at this and paint the greatest picture. And that picture is just so beautiful. But then the more you live here, the more you just take advantage of that scenery, and it's not the same. So I don't want to ever take advantage of the way that I feel when I'm on these 3 products. So when I'm on these 3 products, to think that I feel like that, and then every day just keep getting better, it's amazing. It's just so amazing. And there's just no words to know. And like today, I did my clean slate. I did my 0 in, and then I just went in there and did some restore. And it's just like, it got better and better. And it's like, how does it get better? How does it get better? But it just does. And there's no pain. I have no pain in my body. I have no, and I'm going through a lot of situations right now with my family. And, if it was the old me, I would be a mess. But I'm not a mess. I feel stable. I feel sound. I feel just so vibrant. And it is such a feeling, there again, of love. And I just feel that overwhelming feeling of love, and just that joy that comes with love. And I mean, I can't thank you enough of how you've given me my life back, because I know I've got it back. And it's just amazing, because I never thought that I would ever get this opportunity to feel the way I did when I was young. Literally, when I was younger. I felt like this when I was younger. And I thought, I'm getting up there in age, and with the gadolinium toxicity, with everything that came with that, the cancer, all of that. But now I'm getting that back. Literally, I'm getting that back, and I feel so much younger. I sleep amazing. I wake up, I have energy till wee hours, but I finally just got to say, you know what, you got to stop. You got to go to bed. But it's amazing. It's amazing. It is totally amazing. And just watching that video just even a few months ago of how much even better I feel right now. It's amazing. It's amazing. It just
Can you
is.
believe it's 73 days? That was April 9th.
That is it. 73 days is like, I can't even describe. really, I really can't describe how much better the Restore. And I was looking so forward to the Restore. And it was just like, with everything, and I have lost, now almost 20 pounds, and it is amazing.
Hold on. Don't
And
say that. Don't say that too often. Dory is going to get angry and jealous at you, and she will probably track you down. She will find you. She
you're
will
gonna
make you
get
wear a
it, Dory.
backpack.
You're gonna get it, Dory. You're gonna get it. But it is just, I can't, there's no words that describe the feeling. And it's better than any drug, like I said, I've ever done.
And you've done a few of them. I mean, let's
have.
not front on that. Cocaine, meth, and
Yeah.
like you were touching on. I mean, that's
I did a
what
lot
like
of
to call-
I did a lot of speed as well. I like to have the upper. I never like to
Yep.
be lower. I always got that upper. So that's why I got into the meth, because the speed didn't do it for me anymore. So, and then when I just started really getting the side effects of the meth and thinking that, and then, it was by the grace of God that I was able to get off of that. And I was in bed literally for 1 whole month and lost a whole month of my life.
Mhm.
Didn't know where I was at for 1 month. But I'm thankful, because I got into some bad stuff. I believe that's what happened, is I got into some really bad stuff, and it really almost killed me. So my sister, she took care of me. And so that part of my life, I don't really want to remember, but it's where I am today. It really is where I am today. And I'm thankful, because even now today is awesome.
comparing the other stuff to how you feel now, and that was the question I asked you the other day, is it's been 73 days, and how your first response was to taking Restore, and even that was in the first couple minutes, but even a few hours later when we were talking about it, you're like, holy cow, I still feel amazing. But now even today, so 73 days later, that process, that feeling that your body gets when you're taking Restore, that hasn't dissipated, correct?
No, it has not. And it's just actually, because I really feel every day I get cleaner.
Yep.
So every day I even get better with that feeling, that overwhelming joy and love, and just that overwhelming feeling, just, it doesn't go away, and it lasts. For me, it lasts a long time, even with a half of a sachet. Now, if I do a whole sachet, y'all better hold on, because it's just, I'm gonna go. And that's what I really liked about the meth and the speed, is because I liked to go without feeling that tiredness, without feeling that mind but this almost kind of gives you like a mind alteration, because it's in a good way. It's that good feeling of joy and that love and that peace, and that just doesn't come with any drug that I've ever dealt with, especially when you're coming down. And this doesn't do that at all.
So what you're saying is Restore, Zero In, and Clean Slate, we will call it a Trinity.
Absolutely.
For $200, it should last you about a month.
Yes.
Would you say it's better than drugs and less
Absolutely. Expensive? Yes. And less risk, really, because I think, with $200 a month, I've got my health. I don't have to worry about if they're going to have to take me off to the hospital, or I'm going to be in a grave somewhere. So I'm overwhelmed with the way I feel. Can't get enough.
Well, thank you, Teresa. I mean, it's just been amazing to watch you. I mean, from where you started when we first spoke to now. I mean, the transformation has been incredible, and so we just look forward to just sharing the journey with you.
Thank you, and I'm excited to share it.
You're so welcome. Okay, so we need to close the call down, because it's going on an hour and a half, and I know Clayton probably wants to go for another hour, but first I want to hear from Michael. What's going on here? because he has his hand up. Or who is, let me see.
Well, so does Patricia and
And
Birgit.
Patricia, and then we have Birgit.
Yeah. So.
Okay, just very quickly, I just wanted to give another tip if you want to do a facial, to do a peeling beforehand, because that also helps,
Oh, yeah.
to fine the pores and everything. It really does help to open, so Restore can work even better.
And for the guys, so you understand this, because I learned this, when the girls talk about doing a peeling, that is not using the peeler that you get in a drawer in the kitchen. That stings. Do not do that. There are other ways.
Indeed, Clayton, indeed.
Birgit.
Go, Birgit.
And then we have Laura. Birgit.
Yes, I was going into your T-shirt, Alchemia or Alchemy.
Oh.
Yes, this is something I studied for a long time. And the third part of the great opus, the great work of alchemy, is called Citrinitas. Citrinitas, exactly. And this is the yellowing. And citrin is a stone. And if you look it up, it's a quartz. And the chemical formula of the quartz, of the citrin, is SiO2, which is exactly what clinoptilolite is. And our clean slate. The yellowing is the part that we have in Zero In and in our Restore. And the sense of doing the great work, absolutely, is to transform or transmute body and mind of the human. And that's exactly what we are doing. And Teresa, this is why it is having such an effect on your whole entire being, because there is more to our three products than you might see at first. And it has it has a higher meaning, but whoever is not into that will not understand what I'm saying. But who has studied all those topics will understand that we have more here than you can see on the package.
Thank you, Birgit.
Laura.
Hello, can you hear me?
Yes, we hear you. Hi, Laura.
Hey, I wanted to ask, if you take Zero In for a while and then stop, will the body continue to make dopamine and serotonin, or might you end up with a sudden drop in the two?
It'll continue to do it on its own, but it won't do it at the level that you're going to get from adding the goodies, because it's an agonist or a neurotransmitter enhancer. So it's a lot like gasoline on a fire, right? If you start a fire with a bunch of logs, you'll have the fire burning, but if you throw gasoline on it, you'll get a lot bigger flame. But eventually, if you don't continue to put gasoline on it, the fire will go down a little bit. It'll still be burning on the logs, but if you add that accelerant, you're going to get a bigger push. The really cool part that we found with Zero In is it doesn't create tolerance. It doesn't create addiction. And it's just enhancing your body. It's like salt, right? Salt is a flavor enhancer as well as a preservative, and you put it on food, it's great for you. It makes food taste better, at least for me it does. But when you don't add salt to food, you don't lose the flavor of the food. It might not just be enhanced as much.
Doris is asking, can you answer 10 drops on the bottle is showing twice a day? Yes, that's true.
Yeah, here's a story for that. So when we created Clean Slate initially, the standard dose for the sibling has been 10 drops twice a day. So we created the formula as that standard. But then when Christina went to work doing what she's really capable of doing, and she kicked it up a notch, or 12, and she turned the volume, usually the volume goes from 0 to 10 or 0 to 100. She turned it up to about 357,422. When she's like, hey, I want to add the trace minerals, I want to do this, and I want to add more vitamin C so it can do this, and we want to do this to it, and I don't want it to cost more. I'm like, okay. So what we know now is 10 by 2 is way more than most people need or can handle, which is, from a business perspective, it's pretty terrible, because you don't use as much of it. So the repetitive aspect of reordering isn't as often as we had predicted, but a bottle can take care of a family versus one person now. So yeah, the bottle says 10 by 2 is recommended. But really everyone, that we're talking to now starts with 1, 2, or 3 drops a couple times a day, and then you'll find what works for you. Granted, 10 drops twice a day is freaking amazing. But a lot of people, really can't handle that much because of how amazing it is. But yeah, Birgit's right. If you use less clean slate, you get to afford more Restore, which is a good balance. So what else we
Absolutely.
got?
Well, I think we should end our call. And don't forget, next week, Dr. Rao will be presenting, and it is his birthday. So we make sure
Yes.
we have hats on for next week. Go out and get hats for Dr.
We
Rao.
got hats and streamers.
No.
Touch.
Bye.
Bye.
Bye-bye.